If you're missing a tooth, you're not alone. Many people suffer from this problem, which can be caused due to a variety of factors like injury, decay, or gum disease. But the good news is there are several ways to replace a missing tooth. And one of the most effective and long-lasting solutions is dental implants. Hi, I am Dr. Vinay Mohan, an implantologist, and I'm here to share some valuable information about dental implants. In this video, we will discuss what are dental implants, the process, pros and cons, types of dental implants, complications, pre and post procedure care, general do's and don'ts, alternative to dental implants, a bridge versus an implant, FAQs, and many more things. Let's start with what dental implants are. Basically, these are artificial tooth roots which are either made up of titanium or zirconia that are placed in the jawbone. Once they are in place, they provide a stable foundation for a tooth or a bridge. So why dental implants? When you lose a tooth, you don't lose the crown alone. You also lose the root, which is the foundation of the crown. So what happens when you lose the root? When you lose the root, two things happen. Your bone dissolves and the adjacent teeth move into the vacant area. So what happens if the bone dissolves or the adjacent teeth move? If your bone dissolves, it becomes thinner, weaker, and also loses a lot of blood supply. Now let's say at a later date you would want root replacement for fixed teeth, then it would involve extensive and expensive procedures. If your teeth move, they can land up in several issues like caries, gum issues, plaque or tartar accumulation, joint issues, and so on and so forth. Hence, replacing the missing tooth is like preventing a future calamity. So why are dental implants so popular? For starters, they're very durable and can last for several years, even a lifetime with proper care. In addition to being long-lasting, dental implants are also very versatile. They can be used to replace a single missing tooth, multiple missing teeth, or even a full arch of teeth. Dental implants can also stabilize loose or ill-fitting dentures, making them more comfortable and secure. Another benefit of dental implants is that they help to preserve the integrity of your jawbone. When a tooth is missing, your jawbone starts to deteriorate, causing a sagging or a sunken appearance in your face, as well as other oral health issues. Dental implants stimulate the jawbone the same way natural teeth roots do, helping to keep the bone strong and healthy. Of course, there are some potential downsides to be considered. Implants can be expensive, and like any other medical treatment, success depends on several factors. However, one can improve the success rate by choosing an experienced and qualified dentist and following proper aftercare instructions. Let's cover the process of dental implants now. So what to expect when you're getting a dental implant? Here is a general overview of the whole process. The first step is consultation with the dental specialist. During this consultation, the dentist will scan your mouth, take a few x-rays, make impressions of your teeth, and discuss your medical history. Also, if required, he might recommend you take a 3-dimensional x-ray. Based on the examination and tests, the dentist will develop a treatment plan tailored to your needs. This will include the number of implants, the type of implants, and the placement location. During the surgery, the dentist makes space for the screw or implant in the tissues and the implant is placed. The implant is made of titanium, which is biocompatible and fuses with bone over time. After the implant is placed, the implant fuses with the jawbone through a process called osseointegration. This process can take over 3 to 6 months to complete. Once the implant fuses with the jawbone, the dentist will attach an abutment to the implant. The abutment is a small connector that attaches the implant to the future crown or bridge. Finally, the dentist will attach a custom-made crown or bridge to the abutment, completing the dental implant process. Let's discuss the different types of dental implants that are available. The first type of implant is an endosteal implant. This is the most common type of implant and it is made of titanium. It is shaped like a screw and is inserted directly into the jawbone. Once the implant is inserted, the bone around it will heal and fuse with the implant, creating a strong foundation for dental prosthesis. The second type of implant is a subperiosteal implant. This implant is placed below the gum line but above the jawbone. It can be used in cases where bone density is not enough to support an endosteal implant. Though this implant is not as common as an endosteal implant, it can be used in particular cases where bone grafting is not an option. The third type of implant is called a zygomatic implant. This type of implant can be used when there is not enough bone in the upper jaw to support a traditional implant. This is usually longer than a traditional implant and is placed in the cheekbone, which has got more dense bone than the upper jaw. Finally, there is the mini dental implant. These dental implants are smaller than traditional implants and are used to stabilize dentures or small teeth in areas where traditional implants would not fit. These dental implants are less expensive and at times require less invasive surgeries. Now let's talk about a few adjunctive procedures that might be required during endosteal implant treatments. Additional procedures such as bone grafting, socket preservation, and sinus lifts might be required. Bone grafts are usually used to augment bone and create new bone. Sinus lift is a simple procedure that is performed to create more bone in the upper jaw. Your dentist or implant specialist may recommend the best type of dental implant according to your needs, based on your oral health, jawbone density, and other factors. Certain challenges might arise during your implant procedures, which you must be aware of. One of the most common challenges during implant procedures is reduced jawbone density. This can be addressed by using bone grafting procedures, such as transplanting bone from another part of your body or using bone grafting material. Another issue that can arise is getting the gum line right. Uneven gum lines can lead to unnatural looking implant treatments or can cause discomfort to the patient. For this, we can do a tissue grafting procedure which involves transplanting gum tissue from another part of the mouth to create a more natural looking gum line. Aesthetics is also a common concern, especially in front teeth implants. Here, we could use digital smile design software, which allows the dentist to plan implant placement and create a customized plan for each patient. While there are challenges and complications that can arise during dental implant procedures, these issues can be addressed with proper planning and use of advanced techniques. Hence, patients can enjoy the benefits of a beautiful, healthy smile. Being prepared for your implant will help you manage your anxiety. So what should you do before getting your implant procedure done? The first thing you need to do is to ensure that you have a healthy mouth. This means brushing and flossing your teeth regularly and making sure any necessary dental treatments are done before your implant surgery. Also, kindly inform your dentist if you have any health conditions or taking any medication. During the procedure, you will be under local anesthesia and hence would not feel any pain. The dentist, using a very simple process, would place the implant in your jawbone and the entire process might take 15 minutes to an hour. Post the procedure, you might have some discomfort and the same can be addressed using necessary medications. After the procedure, it's important to take care of yourself and follow the dentist's instructions. Here are some general do's and don'ts that you need to keep in mind. Post the surgery, take all the prescribed medications. Apply ice over the surgical site to reduce swelling. Ensure that you are on a strict soft and cold diet for the first 24 hours. After 24 hours, start warm saline rinses and maintain oral hygiene by brushing your tongue and effective plaque control. Do not smoke or use tobacco products as they can delay the healing process. For the first 24 hours, do not eat anything hard, hot or spicy. Do not rinse your mouth or spit out. Ensure that you do not use a straw as the sucking motion can dislodge the blood clot and delay the healing process. Also, do not eat on the site of the surgery as it can irritate the area. It's important to stick to a soft diet for the first few days after the surgery. Here are a few examples of foods that you can eat: curd rice, fresh fruit juices, porridge, smoothies, and yogurt. And here are some foods that you must avoid: hard or crunchy foods like nuts and popcorn, chewy or sticky foods like caramel and taffy, acidic and spicy foods like salsa and citrus fruits. I also want to talk about some alternatives and compare them to dental implants. The less effective options are removable dentures and dental bridges. Traditional dentures are removable and require daily cleaning. They can replace an entire set of teeth or just a few missing teeth. Dentures are the most affordable option, but they do not fit as securely as a dental implant. Also, they can cause discomfort or embarrassment since they can move or slip. Since the dentures sit directly on the gum and not the bone, they can cause bone thinning, also called bone resorption. A dental bridge involves using the adjacent teeth as support to replace the missing teeth. A bridge is attached to the adjacent teeth using dental crowns, and false teeth fill in the gap left by the missing teeth. A dental bridge should never be advised when there is sufficient bone for a dental implant. Also, a dental bridge involves modifying healthy teeth and may not be as long-lasting or durable as a dental implant. Dental implants can last up to 25 years or more with proper care and maintenance. It's important that you visit your dentist regularly and follow a strict oral hygiene protocol to ensure the longevity of the dental implant. However, dental health is just not the responsibility of the dentist. It's equal and more on part of the patient also. There are several factors that can affect the success of the dental implant. Factors such as a history of gum disease or maybe habits such as smoking and so on. It's very important that you find the right dentist who has a good implant knowledge and also has a good track record. You can take recommendations from family and friends or do a little bit of research online to find the right implant dentist. The cost of dental implant in India can vary depending on several factors like the location, the experience of the dentist, the type of the implant and the number of implants that you would be required. Generally, it would start anywhere between 19,999. As implant procedures are done under local anesthesia, most patients complain only of mild discomfort during and after the procedure. Your dentist will give you adequate medications to manage this mild discomfort during the recovery period. We are Dezy, Dental Made Easy, and we are really passionate about what we do. Thank you for watching this video. I hope this was informative. If you have any questions or comments, please feel free to leave them below. Do like and share this video with your family and friends. If you would like to schedule a consultation, please contact us. All details are mentioned below. Hope to see you at Dezy soon.